Greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you again this morning about correcting space for the eruption of the permanent teeth. And we're doing this by reducing the deciduous teeth in the area where their permanent teeth are erupting, and we're kind of allocating the space to the teeth that need it and let it line up and allowing nature to straighten the teeth out. In other words, the tongue and the lips will push the teeth between the tongue and the lips, and that's where the best place for the teeth is, regardless of what diagnostic ways you're doing it to figure out where it would go. So let's see what happens here. This young man is actually my youngest son, and we're going to go in here and reduce his teeth. This was when he was quite small, and that's not the best picture of him right there, but he had virtually perfect deciduous teeth. And when you have somebody that has just ideal deciduous teeth like this, everything is just as good as you could hope for it to be. The permanent teeth are going to be bigger than these deciduous teeth. So if somebody has space between their deciduous teeth, they might work out even with the permanent teeth when they come in. Let's see what on the bottom. These are lined up just perfect. So he has got deciduous teeth. But watch when the permanent ones come in, these centrals will be bigger than this space, and the laterals will have to erupt behind that. And so we're going to reduce the deciduous cuspids. We take the pulp out of them, and we do these pulpotomies without a rubber dam or anything. I don't show them being done as much as we did in some of these other videos, so you go back and check them to see. And as the permanent laterals, the centrals came in, we actually reduced that a little bit. Now the centrals are rotated like this, and we're going to come in, and most of the time we just take the deciduous laterals out and let the permanent centrals line up, and when the permanent laterals start up in there, we come in and reduce the deciduous cuspids and do the pulpotomy on them. Now here, these teeth were coming in like that, and by the way, watch this diastema just go away. You don't have to mess with it. When the permanent cuspids start coming in up here, it'll push those teeth together tight. And so stop doing a lot of frenectomies there in the anterior part of the mouth. Just let nature kind of line it up. And watch the way nature just pushes the tongue up against the teeth, and the lips are going to come in and catch them on this side, right here. So we'll look at it again from that angle. Up above, I got the lip over the tooth, but the laterals are back behind the deciduous laterals. That doesn't matter too much. Now down on the bottom, this has got the laterals are erupting behind here. These two teeth are together and squeezed too much, and we're going to have to come in and we're going to reduce these deciduous cuspids right here and do a pulpotomy on them. Now we'll go to the next view here, and we took a little tissue off, but you don't even need to do that. Now these laterals, these deciduous cuspids have been sliced down this way, and we did a pulpotomy on both of them over here to keep this. And nature, now the tongue is going to move up in here and push those teeth into place, and the lip is going to catch them right back out here, and that's where they ought to go. And let's watch that happen. And this is just, I don't know, I don't have a date on that, but just a few weeks after this, the tongue has moved those laterals right up into place, and it's fitting in here. The midlines are pretty well lined up. Don't worry about this now. When the laterals up above start in, we'll go in and do the same thing up there. All right, you can see this diastema. This was back before we wore gloves. This young man is a pastor of a church in North Dallas now. It is about 50-some odd years old, and so this was done quite a while back. Now watch, when the permanent laterals get up here, we'll have to make a space, and we're going to do the same thing on the upper teeth and take it down. Now the bottom teeth, you remember where they were? They have come in and they've just almost fit in here, just a little bit of problem right there. Now you've taken the nerve out of these teeth, you can go in here and give them a little more space if you want to. And we're going to watch this, and when either this or this come in, we're going to do the other one, and then we'll go back in here and do the second phase of this. I'm going to do both phases with this deal here. Just go right through both of them. All right, here he is a little later in life, and he's got a little overjet. Now the laterals are coming in behind. Let's look. The diastema is closed a little bit, but not like it will do. Now we're going to take the deciduous cuspids down, and you will see those laterals come up in place. Now one of them is in like that right now, so we're going to come in and take these cuspids down, or reduce them and do a pulpotomy. This is the lower teeth now lined up quite well. And here we've done the pulpotomy now, and we put the zinc oxide eugenol in these teeth. And we'll just hold on and just wait and watch this correct itself. The tongue shoves the laterals up there in place. Now this is 2nd of 75, and I don't know, I don't think I had the deal, just doing my own child. We didn't take complete records, everything. So, but the laterals are up almost in place. We've still got about half of that diastema left. And now the cuspids will start down in here, and they'll push. And if you'll notice this lateral that's kind of like that, that cuspid is up in this area somewhere, pushes that down. And we'll watch this as it develops here. On the other side, you see the lateral kind of angle like this, and this cuspid will be coming in this area. And whichever one of these goes first right here, we'll take the other one, and we'll reduce the deciduous molar behind for the rest of it. Now this is getting a little better. The tongue is moving it up there in place, and this is holding down here on the bottom. We've lost one tooth down here, so that we'll take the other one out, and then we're going to reduce this over this way. Now this is further down the line. These teeth have come in, and the cuspids are starting down in here. They push the laterals over, and the tongue, I haven't touched him now with any appliance to regulate this. We just doled out the space and let nature straighten the teeth. And if you got somebody that's breathing right, they don't have any thumb sucking, tongue thrust allergies, or a whole bunch of stuff in there, they're breathing normal. Look where these teeth have come to now with nothing in there other than just letting nature take its place. And so let's go on and see what happens here next. Now we've removed the deciduous teeth above, and now we've taken this deciduous tooth out, and the bicuspids are here, and the cuspids are taken out here. We need to come back and take these off, and I think I lost, those teeth came out so quick that I didn't cut them off, and this lined up down on the bottom, and we didn't do the reduction of the deciduous molar. This is a permanent 6-year molar coming in, and these teeth have fallen into place all around here without being touched with brackets or bands or whatever you're using in there. You just let nature. This tongue came in and pushed those up, and the lip caught them on this side right here and catches them and straightens those teeth out. And that's got equal pressure this way and coming in from the other side too. And so it straightens those teeth out. Now, here he is a little later down the line. He's grown up a little, and his teeth are coming in, and they look almost ideal. His cuspids are sticking, they're out just a little bit, but they get better by the pressure of the lip in there. This midline, the diastema is completely gone, and I did not go up and take the diastema out. And this is my son, so his name is Mark right there. Now, the cuspids are fitting in class 1. Now the bicuspid is coming in here into this remaining space. And the lower teeth are lined up like that, and they haven't been touched orthodontically. And they couldn't have possibly done that. Well, I'll say it's not impossible, but this could take place with nature, but it's given a space where it's needed, and the other teeth wouldn't erupt in there, but this 6-year molar and everything's coming through. And this is the way it was in 1979, and you couldn't get it much better than that with whatever. It's lined up here without one thing touching that. Now there are the deciduous molars that I flipped out, and where we did the pulpotomy on the molar, the cells that eat the dentin away eat up inside here and left the zinc oxide and eugenol, and so I just did clean this one up and took a picture of it. This is where we did the pulpotomy right here. So I thank you for watching, and I'm going to close this out right now, and I'll finish it up. And so thank you very much for watching.